In the last session, we heard Dr. Cutter speaking about doctors using treatments without a lot of clinical trials based on several issues, including, albeit limited, some experience and some knowledge of the organisms and what they did, but also out of desperation. And you had a chance to see from the patient's perspective here what life can be before and after the helminths. And so our next speaker is going to tell you a little bit about herself and experiences. Debora Wade, come on up here. Now, I don't know exactly what we're going to hear, but I've read a bit about her story on her internet site. She has a blog that you all might care to take a look at. And really, this is a great opportunity for us to see this field from a new perspective. Thank you.
So my name is Debora Wade. I have had Crohn's disease for over 20 years, and since December of 2007, I've been experimenting with helminth therapy. So in other words, I have approximately 15 hookworms sucking on my small intestine as I speak. Crohn's disease is an autoimmune disorder that primarily affects the digestive tract. Right now, 1.5 million people in the United States alone suffer from inflammatory bowel disease. That includes Crohn's disease and ulcerative colitis. It's one of the many autoimmune diseases that are fast becoming an epidemic in the non-industrialized world. According to the American Autoimmune-Related Diseases Association, approximately 50 million Americans, or 20% of the population, or 1 in 5, currently suffer from either allergy or some form of autoimmune disease. And as diseases go, Crohn's is one of the more miserable ones. The immune system mistakenly attacks the digestive wall, which can cause severe inflammation. Side effects can be very dramatic. Strictures, which are scar tissue that forms in the intestine, which requires surgical removal. Fistulas are openings from the bowel to other organs. I have moderately severe ileocolonic Crohn's disease. I was diagnosed when I was 16 years old. I'm currently 38. I've already had my descending colon removed and resected, and I'm trying to avoid another surgery, but statistically my chances are grim. So in late 2007, I reached the place where every patient with a chronic incurable disease fears. I ran out of drug options. I had failed the last medication in the Crohn's disease arsenal, a biologic called Humira, or adalimumab. Humira tripled my inflammation and made my symptoms 3 times worse, and it also causes a 4-fold increase in certain cancers and life-threatening infection. So this is part of the risk-to-benefit ratio we patients have to choose from every day. At this time, I was 137 pounds. I'm currently 155, so that was very underweight. I had bloody diarrhea over 15 times a day. I was up at least 5 times a night. I ate about 5 to 10 blended foods. I was unable to work. I had severe ileocolonic pain. I had night sweats every night, and I had low-grade fever every day. At this time, the only drug left to try was Methotrexate, which is a chemotherapy drug used in low doses for many autoimmune diseases. As you can see in the important warning, Methotrexate may cause very serious side effects. Some side effects include death. I also could try 2 of the drug trials at UCSF, but because I had failed Humira, I had to wait 90 days to qualify. So I started to research my other options. Now, I had read about the University of Iowa trials with Dr. Weinstock testing TSO, which is Trichuris suis ova, or the pig whipworm ova. He had done several small trials showing that TSO was safe and effective in IBD, and I went to order the OVA, thinking it would buy me some time until I qualified for the trial. I found the company OvaMed, and it is called Biomonde, which I was confused with the Biomonde people here. The OVA in therapeutic doses cost 300 euros a dose, which is currently about $425, and because the pig whipworms do not establish in the human host, one has to drink the OVA every 2 weeks. This therapy, which is currently not covered by insurance, would cost me over $10,000 a year. So if it worked, this was a huge financial undertaking, and I couldn't work at the time. We were financially on the edge, but I figured I would give it a chance, and I'd figure out how to pay for it later. So I went to order the OVA, but they were blocked importation by the FDA at the time, citing a case where a mature worm had been found in a patient's colon. So I couldn't get any TSO, and 1 week had passed. So I started reading about the hygiene hypothesis, which is now also called the old friends hypothesis or the depleted microbiome theory, and I found many intriguing studies. Helmuth and Harmony arguing that worms prevent the development of IBD, parasitic worms and inflammatory diseases, inhibition of autoimmune type 1 diabetes, does the association between parasitic infection and immune response in multiple sclerosis. And this was a 4.5-year study where they had patients who were parasitized and non-parasitized patients, and they tested their immunological response. They tested their MS exacerbations. The parasitized group over the 4.5-year period had considerably less exacerbations than the non-parasitized group. Does the failure to acquire helminthic parasites predispose us to Crohn's disease? I found so many research articles. They were all pouring in, hypothesizing that the worms were a natural part of our inner microbiome, and there even was a study arguing that the human immune system was developed with these parasites in mind, and because we had, for the first time in human history, lost our parasites, we were responding with inflammatory diseases like never before. The research was overwhelming to me, but I could not get any worms. So I found a dose-ranging trial in Australia testing Crohn's disease with Necator americanus, the hookworm. And I also stumbled across Dr. Pritchard's work at the University of Nottingham, where he had just begun a Crohn's disease trial testing 10 Necator americanus hookworms, and I contacted Nottingham to see if I could join. And it turns out, as an American, I could join the trial, but I would have to fly to Nottingham 6 times over the course of the 3 months. And as it was a placebo trial, I had 50% chance of getting nothing. So I really wanted to be in that trial to get a safe dose of hookworms, but if I knew for sure I was going to get the worms, I would have done it, but knowing that I could have gotten the placebo, having to fly 6 times, and I was way too sick to even fly once. So reluctantly, I put aside my opportunity to participate in Helmuth research, and I kept looking for worms. I found the private company with Jasper Lawrence, Autoimmune Therapy, selling hookworm larvae online. And I contacted Jasper, and the odd coincidence is that he lived in my town of Santa Cruz. And I thought, of all the places in the world that there could be a hookworm provider, how strange that he would live just a few miles from me. So I called him, I asked many, many questions. At the time, he was only offering the infection in Tijuana, so I would have to cross the border into Mexico to get the infection and pay an enormous amount of money for it. Now, the organism goes to the skin, so I figured my biggest risk, because I couldn't find a lot of evidence of co-infection, was that I would go to Mexico and get an empty Band-Aid. But I figured since Jasper lived a few miles from my house, I could always knock on his door and demand my money back. So I went to Mexico for the very first time, and I grew up here in Los Angeles, but I've had Crohn's since I was 16, so the irony is I never went to Mexico because I was afraid of catching parasites. I met Jasper Lawrence, I met Dr. Yamas, who was working at the time. I asked for 10 hookworms to mimic the Nottingham trial. I felt the itch through the skin. They feel like little pinpricks at first, and then it just feels like microscopic larvae burrowing through your skin is the only way I can describe it. I paid $7,800, which included 3 infections. And it was December 17th, 2007, and this was my Christmas present to myself. Now, as a patient putting parasites into my skin, I am often told that I am very, very brave, and people cannot think how I could possibly stand to be putting worms into my body and having them living in my small intestine. But I always answer to these people that the drugs used to treat my condition require much, much more courage. I almost died from a standard drug called 6-mercaptopurine, used for Crohn's disease. It caused neutropenia, which is a loss of white blood cell count. I was hospitalized for several weeks. Getting the drug Remicade, which is another biologic they give via infusion, you usually have to go to your local hospital, which usually is surrounded by chemotherapy patients. Knowing that this drug causes a 4-fold increase in lymphoma while sitting next to a lymphoma patient getting chemotherapy is very frightening. So a handful of worms really seemed like nothing compared to all of the drugs that I had tried in the past. My arm itched a little bit, but not badly, and I had a single red dot for a rash. And now I had read about the intensive itch that hookworms could cause, the terrible rash, so this was very anticlimactic, and I wondered if I had indeed gotten a sham Band-Aid. But day 3 came, and I developed 100.3 fever. My diarrhea increased from about 10 times a day to over 20. And I had no idea if I'd picked up a bug en route to Mexico, if it was the hookworms, if it was something I ate. I had no one to ask advice from. My doctor at UCSF had been unsupportive of trying hookworms. Despite the very little clinical research, he reminded me I had no idea what I would get in Tijuana. So I simply took lots of Imodium and probiotics, and I waited. Luckily, the fever passed after about a week, but by week 3, my ankle started to swell, and then the other ankle, and it soon became so painful that I could barely walk. I went to my doctor. He diagnosed me as having edema and reactive arthritis, and he said arthritis can come with Crohn's disease, but in the 20 years I had suffered, I'd never had arthritis, let alone edema. So again, I suspected the hookworms, but I couldn't know for sure. Luckily, my bowel pain began to recede about this time because I had almost taken an antiparasitic because the joint pain had gone to all joints. But by week 6, I had significant improvement. By week 9, the ankle swelling had gone, the reactive arthritis was gone. By month, I started getting an enormous appetite, which was the joke. I have worms, I have to eat. And I started adding one food at a time. I tested things very meticulously and carefully, so I had pureed spinach at first, and that didn't cause a reaction, pureed green beans, and the 4th food I tested was dark chocolate. I had not been able to eat chocolate in over 10 years, and as a woman, not reacting with digestive consequence to this new food was a revelation. I took a blood test before and at 16 weeks, before my essential sedimentation rate and my C-reactive protein, which are 2 blood markers of inflammation, were 31, normal being 0 to 20, and 5.4, normal being less than 0.8. At month 4, the ESR had come down to 7, and the C-reactive protein had come down almost to normal, 0.9, and I had not been able to get these numbers reduced in years, and I had only had 1 year of a normal blood test, and that was the year after I had surgery, until I was given an antibiotic for something that was not essential, and that was several years before trying hookworms. I was on no medication this entire time. I had gained 20 pounds. I visited Dr. Tournament at UCSF. He weighed me, we compared numbers, he palpitated my abdomen. It was soft for the first time. And this is a note that he wrote to my primary doctor. And we were both sort of stunned, and we were not expecting this to work. And it was so exciting. I felt I had finally found something that was safe and natural, and it worked, and I would live happily ever after. But I made a terrible mistake. At the time, the trial in Nottingham using 10 hookworms was thought to be chosen with safety in mind rather than the number needed for therapeutic efficacy. And there was much debate amongst those of us experimenting with the worms outside of the research as to the necessary numbers required to maintain remission. And since I'd had such a severe reaction to the initial 10 worms, we were aiming for the natural worm burden in the third world, which is, among healthy populations in New Guinea is said to be between 25 and 40 worms. So we thought if we added worms in 2s and 3s weekly or biweekly, I could increase my worm burden while not having the side effects. So we added worms in 2s and 3s. For a total of 35 worms from weeks 10 through 16, and soon after that marvelous blood test, I began to regress. So I found a study that showed that 2 healthy volunteers with an established hookworm infection, when reinfecting themselves, ended up several months later with the same amount of hookworms they started with, all documented with pill cameras that they swallowed. And I started wondering if the worms that I'd added had not attached and perhaps had provoked an immunological reaction that caused me to reject some of my first 10 worms, leaving me with not enough worms for efficacy. So I thought I could find a laboratory to do an 8 count for me so I could determine my hookworm burden. And I contacted UCSF, I contacted Stanford, Quest Lab. I finally got on the phone with UC Davis's large animal division, but unless I was a cow or a horse, no one would do an 8 count for me. So meanwhile, months were passing, my symptoms were returning to baseline, I had lost tolerance to the food that I could eat, I was losing weight. Finally, in December of 2008, 3 ova and parasite tests came back negative, and I concluded somehow I had lost my hookworms. But I had had such an initial positive response to those first 10 worms that before I threw in the towel, I thought I would infect with 1 single dose of 10 more and see what happened. So I got 10 more hookworms February 2nd, 2009. This time they caused more of an itch, more of a rash, some fleeting joint pain. I felt an initial elation after the worms were in my body, which many patients describe. We call it the Hookworm High, which is so bizarre, we would never have expected. And all I can describe it is as if you're meditating. It's more of a peace and a happiness with nature, and that's been a very interesting side effect. So I took a blood test again. My CRP and ESR had been rising. I tested it before, I'd gone back up to 19 and 2.5 at week 4. This had dropped down to 10 and 0.8. So here I started sampling new foods again. I was tolerating them. I could eat wheat for the first time. I drank my first beer since I was 22 and rediscovered that I don't really like beer, but I had not been able to drink it for so long. It was great to test that again. I kept a blog documenting my effects. There is a Yahoo forum right now amongst those people experimenting with helmintherapy, and through that forum, I heard from many patients who were reversing their diverse autoimmune diseases with just a handful of hookworms, and I personally met some of these patients. One man with Sjogren's syndrome had recovered the mucous membranes. He had recovered the moisture in his mucous membranes. There were 2 patients with MS who had gone 2 years without exacerbations. Reports of allergy cessation came in, asthma cessation came in. It was a very exciting time. I personally had a friend with Crohn's disease who improved so well that he sent me a picture of his bowel movement. And only amongst Crohn's disease friends, but when you have not had a solid bowel movement for years, it's the little things in life that we all take for granted. CBS San Francisco contacted me. I did an interview for them. Here I am in my backyard lamenting the lack of helminth research in this country. Here is my doctor, Dr. Turdeman, who, remember, in 2007 had never heard of hookworm therapy, now endorsing the theory, if not the practice. And here is Dr. Homer Boucher, Chief of Division of Allergy and Immunology at UC San Francisco, saying, quote, "Of course, ideally, I'd like to see us figure out what part of the hookworms is responsible for this benefit, so we could develop a therapy we could give without having actually to infect people with a parasite that does, after all, cause problems." So let me interject here by saying that I'm very pleased that research into the worm product is underway and necessary and is needed. But we all must realize that most and many of us patients cannot afford to wait the amount of time it's going to take to develop a worm drug. And we are more than happy to experiment with a live worm in the meantime. And what problems do hookworms cause? They cause anemia in large numbers. But remember, hookworms do not reproduce inside the human host. And I realize that they are devastating to developing children and in the third world. But can we not compensate for anemia in the Western world with adequate nutrition or iron supplementation? Whereas most of our drug choices cause considerably more side effects than anemia. So I just want to remind all doctors, researchers, that the live worm is so much safer than most of what they have to offer to us. But anyway, back to my story. It was a very exciting time. I could ride my bike again. I played with my daughters. I had energy. People who hadn't seen me said I looked the best that I'd ever seen before, and I reached 165 pounds. But because I had lost my worms the first year and I had no idea why, I was more determined than ever to quantify my worm burden. So I went on the internet and I found a tutorial on how to do a McMaster egg count. I bought all of the equipment. I borrowed a very sophisticated microscope, and one morning I did my first McMaster egg count. And for those non-parasitologists or total amateurs in the audience like me, you take a measured portion of your stool, you mix it with a measured portion of a saline solution, you filter it, you pipette it into a McMaster grid slide, and then you count your hookworm ova that is within that grid, multiply it by a number, and that is your hookworm eggs per gram. So it was very fun identifying the ova under the microscope. My daughters have seen them now. Anyone who comes over, if I'm doing an egg count, do you want to see some hookworm eggs? So this is how I tracked my infection, and I was taking blood tests monthly all last year. And unfortunately, I never did a colonoscopy at this time because that would have been definitive proof. So the good times lasted about 6 months, and then the pain in my ileocecal region started to return. I started to become a little bit more reactive to foods, so I infected again with 10 more hookworms. 10 more on September 26th, 2009. The little rash, the temporary lift, worse digestive symptoms, and until week 6 when this cohort matured, and I was testing egg counts. So at that point, it was very interesting to me that the egg count doubled, showing that I had successfully added to my population. I had not displaced the resident worms, and my inflammation stayed normal again for another 6 months. Now here, Jasper Lawrence had been raided by the FDA and had fled the country with his wife and his worms. So it started to become clear that those of us experimenting with helmintherapy had very few legal rights. And there's a lot of confusion right now amongst those of us in the United States of what we are allowed to do with a hookworm infection. Because they have been labeled as a biologic by the FDA, therefore our drugs, are we allowed to incubate the worms at home and self-infect? Are we allowed to work with infectious parasitic organisms? There's a very interesting thing that comes up that we wouldn't have to think before. And there's now a wiki page, open source helminthic therapy, of patients who are trying to gather information and learn what our legal rights are, what we are allowed to do. There's a DIY hookworm therapy for people experimenting with incubation. And just reminding everyone that it is not legal to be incubating and self-infecting, I believe, in this country. Now, I'm sure a lot of you are thinking, why take the risk? The research isn't proven. We have no idea what we're doing. And like I said, that's very true. But I did test myself for all viral pathogens after being infected. I did an ELISA test for Strongyloides infection, which is another organism that could go through the skin, and everything came back negative. Now, the legal way to get helminths currently is to participate in the drug trials, but they are few and far between. If you have multiple sclerosis, there's currently a trial using TSO therapy, the pig whipworms, in Wisconsin. There is a TSO trial for 18 people with peanut allergies. And the last trial is for adult patients with autism. TSO is now being used for autism with some success. And lastly, there will be at the University of Nottingham a multiple sclerosis trial testing 25 Nicator americanus. You can order TSO now and get it shipped to your door. It is no longer blocked importation because of the trials at 300 euros a vial. You can now buy worms from 3 commercial companies, Autoimmune Therapies, who ships Hookworm and now has Trichuris trichura, the human whipworm, anywhere outside of the United States. There is worm therapy using Guerin Advieti, who requires going to Tijuana. And there is a company in Spain called Immunologica, who sells hookworms. And of course, you can always go to the tropics and get the infection yourself. But back to March, April, and May, my inflammation was rising rapidly. My egg count was falling rapidly, and I could not get any worms. I considered switching to TSO because they were available at that point, but I was back to the enormous expense. So I ended up buying worms through Guerin Advieti, another $2,200, back to Mexico, June 2010, and this time I tried 15 hookworms. Now, I had done an MR enterography 2 days before I left, and it showed that the descending colon was very inflamed, and I had a complex fistula going from the colon to the right ovary, although it had not opened yet. So it was very disappointing, but it also confirmed as the worms were dying, the Crohn's activity came back. So I went to Mexico, I got 15 worms, and I had my worst rash yet. Here it is at 24 hours, 48 hours. The new worms hit my gut about week 3, and because I already had significant inflammation, the symptoms got very, very bad. I started having worse diarrhea, a lot of colonic pain. I decided to go on prednisone at this point, which is a systemic steroid that dampens the inflammatory cascade to buy me time until the worms matured. They matured at week 9, and my egg count shot up to 500 to 750 eggs per gram, and I started feeling better, and I was almost weaned off of the prednisone. But this is where I made my second terrible experimental mistake. Because I'd had surgery, because I knew about the fistula, and because there were many reports of people with ulcerative colitis who were having improvement from the organism Trichuris trichura, I thought maybe if I added the safer organism TSO, the pig whipworms, to the hookworm therapy, perhaps it would give me more efficacy than the hookworms alone. So I paid another $4,000, and I bought 7 vials of 2,500 Trichuris suis ova. And I drank my first vial of 2,500 TSO. I got this shipped to my door after you can't see from afar, but there's a close-up on the little box. TSO, a pearl of nature for immune therapy. The liquid tasted slightly salty. I always enjoy the marketing, and I felt queasy for a few days. 2 weeks later, I drank another vial, and this time I had diarrhea within 24 hours and a low-grade fever and a lot of colonic pain. But my daughter had the flu, and then my second daughter got the flu, so I didn't know whether I had the flu or if it was from the TSO therapy. So I tried 1 TSO dose 3 weeks later, and this dose was thoroughly rejected. I had explosive diarrhea, I had very bad abdominal pain, my fever came, and I went a week and a half like this, getting progressively worse. Unfortunately, I had to go back on prednisone at a higher dose to control the symptoms. I checked my egg count after several weeks, and the hookworms survived the intestinal onslaught, but the egg count did fall. So why did I react so badly to the TSO? Was it the combination of the hookworms and the pig whipworms? Did the TSO activate some bacteria in my colon, which has been shown in pigs? I don't know. And I lost 10 pounds in 1 week after the TSO therapy, and I have not recovered completely. So that was 6 weeks ago. It was very hard coming here today despite my digestive symptoms, but I would have much rather come and just proclaiming my ultimate success with helmintherapy, but unfortunately it is still a work in progress. I'm now having some solid bowel movements, but I'm still up at night occasionally. Things are not where they were early this March. So am I a failed helminth therapy patient, or have I demonstrated remarkable efficacy for a small amount of worms? Should I stick with the hookworms? Should I go back to conventional drug therapy? Should I try Tricura's Tricura? I now have 3 new drug options I did not have in 2007. They're all biologics. One of them is in the same class as the drug I failed, so my doctor said I have a 20% chance of remission on it. There's a new drug approved for psoriasis using off-label for Crohn's disease, so we don't have statistics of its efficacy. And my last option is Tysabri, which is also known as natalizumab, and it has a 1 in 1,000 chance of PLM, which is a rare infection of the brain that cannot be treated, prevented, or cured, and usually results in death. And of course, there's always methotrexate. So I am crossing the border tomorrow and getting infected with 10 more hookworms. If these next hookworms fail to bring me back into remission the next few months, I will have to try the next medications. So this journey has been a great adventure. For better or for worse, I'm the voice of all the helminth therapy patients who want to get worms safely, who want to participate in worm research. If I can do anything to influence you, I urge all patients and doctors to help us experimenting with this so that together we can prove or disprove that helminth therapy works. The research is going so slowly, we will lose our colons. We will forever be confined to a wheelchair, especially if we have to wait for the worm-derived pharmaceutical product. We are willing to be case studies right now. We are willing to do before and after testing. We want to help educate our doctors about this therapy. We have money to donate to research, and we just don't have the collective organization to unite all of the 1 in 5 Americans who potentially could be helped by this therapy. There was an article online recently in a journal called The Evolution and Medicine Review, and it was called Reconstituting the Depleted Microbiome to Prevent Immune Disorders. And from that article, I'd like to read a couple of paragraphs that I think most eloquently describe the urgency that we patients feel. We as immunologists are now faced with the unsettling realization that the immune system we have spent all of our effort and energy studying over in the past 50 years has turned out to be dramatically different than the system derived by natural selection. We find that normal is not helminth-free, and that our co-evolutionary partners must be included if we want to address the normal state of things. From a medical perspective, it is difficult to imagine that we will be able to restore the immune system to normal using a pharmaceutical that is directed at one cog in the immune apparatus, when in fact the entire apparatus is entirely out of sync with nature. Pharmaceuticals do not effectively recapitulate biology derived by hundreds of millions of years of natural selection. At present, we need to direct intensive research towards biome reconstitution. We need to know which organisms to utilize and when and how to utilize them. We need to know the effects of biome reconstitution not only on one generation, but on subsequent generations. In short, we need to know how to reconstitute our biome and keep that biome healthy. It is time for a paradigm shift in the enterprise of biomedical research and subsequently of medicine. Our evolution and our resulting biology require it. I should not be having to travel to Tijuana to get infected with hookworms. I should not be doing my own egg counts. I should not be begging my doctor to study my response. I should not have to wait years for the research on the depleted microbiome theory to be proven. What can we do to make this easier? How can we influence helminthic therapy research? How can we unite the autoimmune communities together? How can we start repleting the microbiome? How can we educate and convince the medical establishment to support us in our experimentation? Can we share the information that we're gathering? And there are over 200, if not 300 patients right now trying this with a diverse set of diseases. Could we have an online database? Something where we could collate our side effects, our MRIs, our colonoscopies, anything that we could do to provide proof of efficacy. There are still so many unanswered questions about this therapy, and I realize that we are at the forefront of all this. Dr. Pritchard, who I wish could be here today, once told me that I was in uncharted immunological territory. And I realize the limitations that all doctors and researchers have on themselves, but this is a worm. And if we're meant to be parasitized with a small number of these worms, there has got to be a way that we can get safe access and a way that our standard research and medical system can actually do research on one of these parasites besides TSO. So I'm only one patient of helminth therapy, and I've experimented far more than most. I am the only patient I know of who's doing 8 counts, and I've used 3 out of the 4 of the commercial companies now. I regret not participating in the trials, but the stakes were too high, and I feel I have showed remarkable effects from a very small amount of hookworms for about 6 months at a time. And I admit that Crohn's disease is a waxing and waning disease, and because I did not do colonoscopy, this is a case study. This is not a case study, and it's anecdotal at best. But like all patients with life-threatening autoimmune diseases, I am desperate for a therapy that is safe and natural and has potential. And I do feel that I've found that in helminth therapy. I'm just ironing out the little details of dosage and species. And so I can't tell you if helminth therapy is going to be successful for me in the long term. I'm only 3 years into this. I will have to wait several months to see if the new worms work, if I'm able to taper off of the prednisone without ill effect, if the hookworms alone will be enough. So my worm journey continues. I hope I've inspired some of you to help make this therapy more available so that other patients do not have to follow in my footsteps. I hope that there are people in this audience who can bring this therapy greater attention. And I hope I provoked a lively discussion on our legal and evolutionary rights as human beings. I thank the commercial providers for offering us this therapy to experiment with before the research is done. And mostly I thank the doctors and researchers who are moving forward with this, because as I have discovered, knowing about this research has truly been life-changing. Thank you.